Many people suffer from fatigue, and when I evaluate a patient, I look at the hormonal balance that they have in their body. One of the most important hormones to look at when you're thinking of fatigue is the thyroid hormone. The thyroid hormones are produced in the thyroid gland, which is located on your neck, and there are actually receptor sites for thyroid hormone in every cell of your body. So it's kind of the way we get energy. And if you don't have enough thyroid hormone, people will feel very tired. And it's kind of like this steady, low tiredness. And they just don't ever really feel like they have any energy. Some of the symptoms of low thyroid is lethargy, low energy, no ambition. It can be dry skin. You often see a thinning of the eyebrow on the lateral third. People could get, women will suffer from miscarriages. They'll be crying easily. They will have constipation. They'll have digestive disturbances and edema on their eyelids. There's a couple other symptoms as well. The best way that I mean, I can hear when I'm talking to somebody, it's like they're tired. They're really exhausted. And it's not that they're depressed. And it's kind of unfortunate that this symptom is not well diagnosed in most doctors' offices. If women are particularly prone to this because their hormonal systems are more complex than men. So they have more hormones to deal with, and then if they're under stress, their hormones, are affected. But the typical, thyroid patient will be complaining of, I don't have any energy, I'm tired, I'm exhausted, I don't have any motivation, I can't do anything. And then the doctors will think, it's often misdiagnosed with depression. They'll say this person sounds depressed, so they give them an antidepressant. And studies have shown that antidepressants do not help thyroid. It doesn't help people make more thyroid hormone. There actually was a study done that involved antidepressants coupled with thyroid hormone, and those people did feel better. They started to get better because it was probably more from the thyroid hormone than the antidepressant, and there's certain cases where doctors will prescribe thyroid hormone with the antidepressants because it makes a difference. So one way that I diagnose the thyroid problems is to do a basal body temperature test. And in my office, I have one of these temporal scans. So you just quickly scan the forehead, and you get a reading on what the person's temperature is. And 98.6 is the ideal temperature for the body. It's that way for a reason. We need a warm body to run all the processes, the enzyme reactions. They need heat to have them happen. And if the temperature drops low, it's just like on a cold day, you just don't feel like moving around. You just want to kind of like do nothing because you're too cold. So we got to get the temperature up to a normal temperature, and then the person will have more energy, and they'll be able to move around, and they'll start thinking better, and they'll also lose weight. It's such an important part of the fatigue program is to address the thyroid hormone. Another thing that I find really helpful is iodine. Some people are actually low in iodine, and that's very easily taken as a supplement because the thyroid, in order to make thyroid hormone, you need iodine, and our soils are a little bit deficient in iodine, so it often has to be supplemented. And people make a very quick recovery. I've seen nice improvements with just simple iodine being added to the diet and to the supplement program. People, they get their energy back, they lose weight, they start living their life again. It can make a huge difference. And if your doctor is not really responding to your concerns, I just recommend people to keep looking for another doctor. There's doctors that are trained in anti-aging medicine and holistic medicine, functional medicine. These are the type of doctors you want to go to that have experience in treating the thyroid, because the lab tests are often misleading. People can have perfect lab tests that say, oh, this person has normal levels of thyroid stimulating hormone, or they have normal levels of T4, and they say, you're fine. You know, the doctor will say, you're fine. And the person's saying, I am exhausted. I can't do anything. I'm freezing. My hands are freezing. My feet are freezing. I have to wear socks to bed. I'm crying all the time. I mean, there's the picture of low thyroid, and the doctor says, the labs are great. You're good. So I just don't want people to give up, to keep looking for an answer.